Guilford County Division of Public Health is currently investigating a possible adult measles case. This after measles cases have been popping up across the country as an outbreak spreads across South Florida. WXII 12 spoke to a local pediatrician who actually dealt with a measles case in his own office back around 2018.
It's airborne and it's extremely contagious.
Dr. Kirk Walker knows all too well the panic that comes with a measles outbreak. He dealt with a case in his office several years ago.
Everybody that had been in our office within 2 hours of that patient had to be called. Their family had to be called. Every family member that was here had to be contacted. They all had to receive a second dose of MMR if they couldn't show that they've had one.
Because the measles remains airborne for a long period of time, it is highly contagious and spreads easily.
But let's say 100 people were sitting in the waiting room, and a person with measles who didn't have the rash yet or anything but was contagious walked through the room and left the room. 90% of the people that were in that room who were susceptible would be infected. It's that contagious.
Cases have been rapidly spreading recently throughout South Florida. Here at home, the Guilford County Division of Public Health is investigating a possible case.
The thing too is that you're contagious for about 4 days before symptoms begin and about 4 days after symptoms start. And so the majority of the exposures occur when you never knew that you were exposed.
As health leaders investigate a possible case, Guilford County Emergency Services isn't changing protocols per se, but say they are aware and are actively monitoring the situation.
It's something where it hasn't really shifted our day-to-day as of yet, nor are we specifically expecting it to, but it's something we could absolutely adapt to if the need arose.
Dr. Walker says the best thing anyone can do is get fully vaccinated.
And after exposure, if you get a vaccine within 72 hours, generally that's protective. But for the most part, everybody needs to be vaccinated.
And Dr. Walker says there has been a huge drop in vaccination rates, which certainly is not helping with the spread. As far as any symptoms, measles is associated with a rash, high fever, conjunctivitis, and upper respiratory symptoms.